We're back. Dr. Clinite, Chief of Staff, right? Now explain that role and then get into, if you can, the effect of Proposition 46 as you see the impact here in Sonora Regional and throughout the medical community.
Very well. Well, I'm the Chief Medical Officer at Sonora Regional Medical Center, which gives me a leadership position working with the administration of the hospital as a representative from the physicians, a new position that we've just taken. But Prop 46 actually it's an interesting proposition, and when you read it, it has a lot of interesting things like drug testing doctors who have a problem with a patient, and that's a quality issue that is really interesting. But I'd like to tell you that our medical staff already has that policy. We've had that policy for 20 years, that if any physician is suspected of being using alcohol or any drugs, we can go and test them. That's part of being part of our medical staff. The other part of the Prop 46 is called the CURE system, which requires physicians and pharmacists to query the database of all prescriptions that are written for Schedule 2, 3, and 4 drugs in the state of California. Now, that's also a very interesting problem because we have a lot of hydrocodone addiction in the county, and I think that the intent is to try to curb that. But there are a lot of other drugs that are in the Schedule 2, 3, and 4, sleeping pills, muscle relaxants, medications for psychiatric disorders, ADD, and the like, that are also going to require us to query this every time we give a prescription. And that information is going to be out there and can be accessed by other people other than physicians. So if your family member is on a type of medication, that could be discovered and could be embarrassing. It's not covered by the HIPAA regulations, and so that is free information that's out there for other individuals. So that's really not a good part of this law. Probably the underlying reason for this law is to increase the non-economic damages that are awarded for malpractice awards. Right now it's capped at $250,000, and they want to increase that up to $1.5 million.
Do you think that's a fair movement? Is that because the Trial Lawyers Association was kind of behind that? Is that a fair? Maybe that's not a fair question, but why would it go up that high? If you can explain that back to us.
Well, it's about the dollar. It's about putting their taking care of themselves, taking care of their families. I understand that they're trying to access more money, but really, if we're talking about the patient and we're talking about covering somebody who has had a problem, a malpractice event, the economic awards are still there. So if somebody gets injured, they're covered. They're unlimited coverage for what they can be awarded, even for punitive damages. So what the lawyers are looking for is that non-economic awards, and that's where they get paid. They get paid from the non-economic damages, and so that's why they want to see that elevated. And so they put these other little tidbits in about covering, doctors, drug testing doctors, the cures prescription as an enticement for us to decrease or increase their awards that they can get through the non-economic damages in these suits.
Now, recently, you've won an award, a national award for care and quality of care. Is that my understanding?
Absolutely. I'd like to let the people know that this hospital is there are some quality measures that are nationally that were scored by CMS, which is Medicare. We score 100% in all these categories, which has to do with pneumonia protocols, congestive heart failure, surgical protocols, and this community hospital is 100%. So the quality at our hospital is really superb. And we should be very happy with the type of physicians that we have here and the type of care that we're providing our community.
Well, Doctor, thanks for coming by for a few minutes. We're really proud to have you in our community, and thank you for coming and visiting with us here at Gold Rush News. Thanks again.